Hi, and welcome to my vlog on skills and capacities for module SAC 7108. The aims of this video are to assess the difference between skill and capacities based on our weight room activities. I'll be taking a look at two athletes front squatting and two athletes performing pull-ups, each one with a capacity issue or one with a skill issue. I shall be attempting to highlight these issues via the use of highlighting appropriate angles, distances, positional problem areas and restrictions. After these are identified, an explanation as to what interventions may be put in place to aid the athlete to better their movement in these exercises will be put forward with some explanation. So, what is a skill? Skill is defined as the ability to do something well. In our context as strength and conditioning coaches, we are looking for execution as close to our technical model as possible with the optimal levels of coordination, movement and muscle recruitment. Skill is also our global representation of how we move and perform a task. The skill issues identified in this video can be adjusted close to the technical model with the use of the verbal cues given. The understanding of kinesthetic feedback within our athletes allows them to be able to match the cues given so the exercise is represented close to the technical model that we desire. Capacity is defined as the ability or power to do or understand something. In our athletes, we are looking at the capacity to be able to complete a task without restriction or hindrance from their own biomechanics. This hindrance could come in the form of a strength issue, where they are just not strong enough to complete the movement desired, or a mobility issue, where the physical structures and tissues within the body are not able to get into the desired positions to complete the task. Athlete 1 here is a rugby player who has always had an issue with squatting and has a capacity issue that is evident here by the lack of range of mobility. The knee angle inferred in these squats is of around 70 degrees and a deep squat would generally be considered less than 60 degrees. The athlete already has heels elevated by 28 millimeters on a squat ramp, and without this we would struggle to break 90 degrees. In the next freeze frame we can see the same knee angle, but I've added a vertical line for the bar position. We can see this bar position sits very close to the knee joint, meaning this front squat has a very short lever moment to the knee. The front squat normally creates a longer lever arm at the knee and therefore places more torque at the knee joint. However, the athlete is bypassing this to make it a hip dominant front squat position. We can see from his capacity issue here that the ankle range of mobility is very, very low. We have done an ankle test as seen, and the distance between the toe and the wall is about 3 centimeters, and we would like to see it 7.5 or more for a pass test. We can see demonstrated here the distance from the toe to the wall, and we can also see the 53-degree dorsiflexion angle, and we would like this angle to be between 20 and 30 degrees. The capacity issue for this athlete comes from poor Achilles tendons. We can also see as he tries to move his heel back, the heel will lift as the knee tries to touch the wall. These capacity issues have just never been addressed, and they come from a very, very tight Achilles tendon feeding up into the gastrocnemius, therefore causing lack of mobility and lack of range of depth. To address this, we have already used a squat ramp as shown. We are also encouraging the use of PNF stretches, and he is also seeing his team physiotherapist for extra soft tissue work to help with the mobility in this area. The next athlete we see squatting is a female soccer player. The front squat we see demonstrated shows a lack of skill performing the movement. Depth is not achieved, as reaching a depth of just under 90 degrees or 85 degrees in this case. We also see a forward torso projection, again attempting to make this a hip dominant movement, as the bar path as shown here is very close to the knee, and again achieving a knee angle of 86 degrees. We can also see this acute torso angle of 70 degrees at the hip, which would like to be much more upright. The coaching cues issued to this athlete in the front squat are to spread the floor apart with the feet and to drive the knees out. Both of these work to help externally rotate the femur to allow to be able to sit deeper. to sit the bottom between the feet and to look at a focal point in front of you, again to try and keep the torso maintained upright and aid with the balance side of the skill. We can see in the second set of front squats we did after the coaching cues were issued, we are able to get to a lower knee angle of around 75 degrees, which is much more improved. We have a much more upright torso. We can see the bar path is much more through the middle of the thigh, making it the quad dominant movement we would like it to be. We can also see demonstrated here the much more upright torso we like. This also demonstrates this was a skill issue, as the coaching cues have made a big improvement in the skill performed. As we can see from the still image captured here, the hip angle is much better in the second photo, where we've got a hip angle of 81 degrees, far more obtuse and upright. We can also see by these animated ovals as a byproduct that the thoracic spine is in a much more neutral position, and the elbows are sitting higher without having to create a larger lordosis. In this second still photo, we can also see the bar path angle is much more in the middle of the thigh, as well as the knee angle being greater. These red arrows do depict very well the difference between the lever moment, as the red arrows are of the same length. Here we have an athlete with a capacity issue on the pull-up. She is a female runner and lacks the strength overall to perform the pull-ups effectively. We can see here by lines I've put up that her one shoulder raises higher than the other, and as this reps go on, this happens earlier. As we can see coming up as well, I've also put lines which demonstrate how her head is actually closer to her left side than her right, and one side is pulling more than the other. This demonstrates as well she also uses the deltoids and pec minor and major to actually finish the rep at the top. The capacity issue I believe she has is that her latimus dorsi, teres major and biceps brachii are actually not strong enough to perform the movement to a high enough standard. I also believe that the lower trapezius are not strong enough, so they are not holding the scapula in place during a pull-up, so the shoulder is able to float up during the movement. Interventions being introduced to help with the capacity issues in the pull-ups shown would be to strengthen latimus dorsi and the lower trapezius by the introduction of kneeling single arm pull downs, wire raises, lat pull downs, hanging scapular retractions are all now going to feature as part of her program. The final athlete we have here is a male soccer player performing a pull-up. Demonstrating a skill issue. We can see here as he pulls up that the angles, he is desperately trying to get his chin over the bar rather than trying to engage the right muscles. We can see here is driving his head forward and his shoulders towards the bar, internally rotating using the deltoids and pec major and minor. We can see these angles here. The back is straight, the head is leant back, the chin is over the bar, and he's kicking with the knees to generate momentum. Therefore, the coaching cues issued are to tuck the shoulder blades into the back pocket, pull the bar towards your chest rather than chin over the bar, and engage the abs and glutes. We are therefore hopefully going to see more lat engagement and a better position for gaining strength. We can see in these redone ones where the body line is a lot straighter, the lats are a lot more engaged. We can also see the scapulas seem to be moving much nicer, and the head position is much further away from the bar and not trying to get the chin over the bar. We can see the scapulohumeral rhythm being much better, and the shoulders no longer internally rotating to such a great degree. The still image next really illustrates the broken nature of the first one and the much straighter nature of the redone one. This demonstrates that it was a skill issue, as simple cues seem to fix the positions.